The latest NIDS-CRAM survey showing the majority of South Africans, 71%, would take a COVID-19 vaccine if it's available. However, there are major differences for provinces, ages, education and languages. The study, it's the National Income Dynamic Study, the Coronavirus Rapid Mobile Survey, also found primary school children have learnt 50 to 75% less knowledge as a result of the lockdown. Dr. Nic Spaull is from the Research on Socio-Economic Policy at the University of Stellenbosch. He's in charge of the survey. He joins us now. Dr. Spaull, good evening to you. We know that during the lockdown, many people went hungry. There was a severe loss of income for many people. This is the fourth wave of your research. What have you found about how that's changed?
Sure. So the period that we're reporting on here is between November last year and February and March this year. And obviously with the second wave of infections and the lockdown that happened over that period, we do see an employment decline over that period as we lock down. We also see, encouragingly, a slight decline in child hunger, which is also a positive development, although the rates of child hunger and household hunger are still much, much higher than they were before the pandemic. So both hunger and unemployment remain very high, but the latest wave actually shifts the focus towards vaccines and learning losses.
If I've understood your paper correctly on education, you say you believe that for every day of schooling that is lost, children actually lose, I think it's 1.25 days worth of education. How do you work that out?
Sure. So the paper, it's not my paper, that's by Dr. Deborah Shepherd and her co-authors. They're part of the NIDS-CRAM team. And what they did is, obviously, on a telephonic interview, we can't assess children on their learning outcomes. So they drew on data from two different studies, which assessed learning outcomes for children at the grade 2 and grade 4 level in the Eastern Cape and in Mpumalanga. And what we can do is we can see how much children learnt in 2020 and compare that to the gains that happened in 2019 in the same schools. And what we see is that there were learning losses of between 50 and 75% compared to 2019. Now, we know that there were 60% fewer schooling days last year in 2020 compared to previous years, and that was both because schools were closed, but importantly, it was also because of rotational timetables. So even when schools were open, children were only attending on every second day. So if it was 50% lost school days and 50% lost learning, it would be 1 for 1. Whereas if they are losing more than 60% of their learning outcomes, it means that that rate is higher, which is what we are seeing.
I mean, this is huge. This basically means that for many children, I mean, last year almost didn't happen, educationally speaking.
I mean, I think that is true. I mean, think about it. If we missed 60% of the days of schooling, what did we expect was going to happen? I think the more concerning one for me is that this is ongoing. It's not as if this is something that just happened in 2020. The fact that kids are learning much less is still the case now because they are only attending school on every second day. So my fear is that we're actually getting to a point where if we don't get all kids back to school immediately, which seems like the safe thing to do given the trends of teacher mortality are unrelated to schools opening or closing, another thing that the study found, we're going to see a lost generation, the sort of COVID kids, or the lost generation of COVID kids.
It's incredible. We need to talk about vaccines. Obviously, we're expecting the second phase. I get my waves and phases muddled up, I'm afraid. The second phase of the vaccine rollout due to start on Monday. Most people, from your survey, are ready to take a jab.
Yes, so one of the questions that we asked respondents was if a COVID-19 vaccine were available, would they take it? And what we found is that 71% of respondents either strongly agreed or agreed with that statement, meaning that only 29% said that they either didn't know or that they strongly disagreed or disagreed. So it means that the vast majority of South Africans would accept a vaccine. The only problem is we vaccinated at the moment less than 1%. So while 71% would accept one, at the moment less than 1% have actually been vaccinated.
There seem to be quite big differences around provinces and also around education. It's quite difficult to sort of work out why that might be.
So we do see lower rates of willingness to accept a vaccine amongst those with lower levels of education, but we also see amongst the youth and those that trust social media, we see lower rates of vaccine acceptance. the results that you're speaking about there around language is also very interesting and was unexpected. We do find that Afrikaans home language respondents have higher rates of vaccine hesitancy compared to other respondents, and obviously given the concentration of Afrikaans home language respondents in the Western Cape and the Northern Cape, we see higher rates of vaccine hesitancy in those two provinces.
Dr. Nic Spaull, important research. You've also proved something we've all known: social media is evil. Thank you very much indeed. Dr. Nic Spaull, of course, runs the NIDS-CRAM surveys at the University of Stellenbosch.